Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I am Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. While we currently don't have a vaccine to prevent COVID-19, there are many other serious diseases such as polio, measles, and whooping cough that are prevented by vaccination. I am excited to have Amy Pisani, Executive Director of Vaccinate Your Family, join me on this podcast. She is a lifelong champion for children with special needs and a national leader for science-based vaccination policy, including serving on the National Vaccine Advisory Committee. So welcome, Amy.
Thank you so much for having me. I'm very grateful to be on the podcast.
Thank you. Well, tell me about Vaccinate Your Family and why the organization was founded.
Well, Vaccinate Your Family was founded originally as a group called Every Child by Two back in 1996, and we were part of the American Nurses Foundation back then. We later changed our name to Vaccinate Your Family because, of course, we believe in the importance of vaccination at all age levels. But the organization was originally founded by former First Lady Rosalind Carter and Betty Bumpers, who was the former First Lady of Arkansas, and then her husband became the senator of Arkansas for over 20 years. Really, they just spent their entire lifetime trying to tackle this terrible issue of access to vaccines, mostly for children at the time. And the reason we were called Every Child by Two was because we wanted to make sure that children got the primary series of vaccines by the age of 2.
Mm-hmm. So the COVID-19 pandemic reminds us what the world is like without a vaccine for a contagious, deadly disease. However, the stay-at-home orders have also resulted in a drop in childhood immunizations. So is that something that you're worried about, and what should we be doing about that?
Yes, we're really worried about the drops in vaccination. So far, what we're seeing are drops in vaccine orders by physicians, which we assume will then correlate to, lower vaccination rates among children, adolescents, and obviously adults as well. So with Vaccinate Your Family, we are putting out messaging to families to say, look, please do not delay your children's vaccines. Call your provider. Make sure if you haven't been in yet and your child or anyone in your family is behind on vaccines, set yourself on a reminder to ensure that you don't forget, because we all know, and of course this is your area of expertise, these diseases are just waiting sort of in the wings as we're all sitting home in our quarantine status. But, it takes a couple weeks for vaccines to be effective, so I would hate for a parent to, put their child right back into daycare and then unleash some type of infectious disease that would be just as harmful, potentially, as COVID could be.
Mm-hmm. And I know the American Academy of Pediatrics is also reminding people that they should be contacting their pediatrician, and especially if a child's under 2, should be coming in to get their regular checkups, including their vaccinations, to be sure that they're ready. So when we actually lift the stay-at-home orders and kids can return back to childcare and to school, we want them to be safe, right?
Absolutely. And Vaccinate Your Family, our statement on this issue does actually refer to the AAP, the Academy of Family Physicians, and the CDC recommendation for making certain that people are getting up to date, before we go back out into the real world.
Now, it's not just about the kids. Many epidemiologists are worried about a second wave of hospitalizations and death this fall from a resurgence of the COVID-19 and influenza. Now, we won't have a coronavirus vaccine by then, but we do have a flu vaccine. So what are some of the things we could do to prevent this second wave?
So I think everyone will recall that COVID really did start kind of on that downswing of flu, and so there was a lot of confusion as to whether people had flu, whether they had COVID, and the symptoms are so very similar in many aspects to the two diseases. And so we are working with our partners at the National Adult and Influenza Summit, which includes, a variety of organizations, to develop sort of a messaging plan. We may have a small window of opportunity after we get out of quarantine before the second wave of COVID hits, right? We don't really know what's going to happen. We don't know how long we'll have a break, if we'll have a break. But, we may need to get an awful lot of people vaccinated in an awfully rapid time frame in the fall to ensure that, we don't have people in the hospital for both flu or COVID, flu and COVID, and those comorbidities could be, truly devastating.
Yeah, in fact, COVID-19 sort of came, as you said, at the tail end of the flu season. So many of the hospitals were already having some beds because they weren't full of flu patients, but that may not be the case next year. And in fact, I think our flu vaccination rate is usually around, 40% each year, roughly?
Pretty poor.
Yeah, so imagine what we could do in terms of saving beds if we actually got that 40% up to 70 or 80%, correct?
Absolutely. It's pretty, if we could just get our vaccination rates up for flu, it would be a major help to the burden on healthcare. And, I'd be interested to see, Dr. Pan, if people feel comfortable wearing masks again, wouldn't it be amazing if every flu season people started to wear masks when they don't feel well, and we would see future flu seasons, with lower death rates. We don't want to lose anybody of any age, and we lost, over 100 children this year again to flu. So it's an interesting world we're living in now.
Yeah. So what about thoughts about, for example, making flu vaccine even more accessible? I know that people can often go to their pharmacy or other place to get it, but perhaps school districts should be organizing flu drives, flu vaccine drives to try to get as many kids vaccinated as possible.
There's a lot of conversations happening about what the world will look like, in the next season. And everything's on the table right now. And our partners at CDC are working on this as well, of course. So we're working together. We're trying to figure out every potential worldview on how this could happen. I mean, there's a possibility we may not even have schools open in the fall. So we can't just depend on school clinics or maybe like H1N1, we use those gyms. I remember I had just moved to the state where I live now with my very young children, and I volunteered at that H1N1 flu clinic. I remember giving out coloring books for every child by 2 and trying to organize people. I was in charge of intake because I don't have a medical degree, so I did what I could. But it was an interesting time, and I think people really pitched in, and I think it would be amazing to see that happen again.
Right. Now, last year, so we're in the middle of COVID-19, so sometimes we forget, but last year, the United States experienced the largest number of measles infections in over a quarter century, I think since 1992, and we almost lost our measles elimination status. So can you talk to me about what happened? Why did this terrible thing happen last year?
Well, that was pretty alarming for everyone, and I can say it was incredibly disappointing for our founder, Rosalind Carter, because Every Child by 2 was actually formed after the measles outbreak of 89-90, which took the lives of, several thousand people, including many, many children. And so to see this resurgence happen was just devastating for our organization. It happened because people let their guard down. Communities at risk were persuaded, I would say, not to vaccinate their children. We have travelers coming in and out of this country. They're going to areas in Europe that are endemic, or Israel. And when they come back in, measles is the sneakiest virus, and it finds its crack, and it found its way in, and it infected vulnerable kids.
And I think we need to put in context that the measles outbreak that happened in the U.S. was not isolated just to the United States, that in Europe there were large measles outbreaks where people have died. There's other parts of the world as well that experienced measles outbreaks. And in fact, the World Health Organization labeled vaccine hesitancy as one of the top 10 global health threats. So I guess the issue then is that we are talking about countries that have universal health care, ready access to vaccinations. What's going on with vaccine hesitancy?
Well, it is truly becoming a global threat, and we're working with the WHO. Vaccinate Your Family's website was recently certified as scientifically accurate by WHO, and we've been really lucky to be part of this partnership, looking at what is happening out there in the world of social media that is affecting people all over the world. And it's absolutely clear that people who are skeptical about vaccines are using things like WhatsApp and other technologies in countries to spread seeds of doubt and have people not vaccinate. And then it's just becoming a worldwide phenomenon where we can't seem to tackle this issue. And it's upsetting to think that people from developed nations would take advantage of people in nations who are struggling so badly. And I'm not talking about Europe, but, places like Africa and India. These kids are really vulnerable. They have other comorbidities that make them specifically at risk. And I just feel like as a public health person, it makes me want to cry to think that we would spread that kind of doubt among those communities.
Now, in response to the measles outbreak and to a prior whooping cough outbreak where actually infants had died in California, California passed legislation to increase vaccination rates and restore community immunity. However, in the process of trying to pass this legislation, anti-vaccine extremists made death threats against legislators and staff and even committed physical assault and vandalism. Can you speak to how anti-vaccine extremists have tried to politicize vaccination?
Oh, sure. And, in the public health realm and, all of the volunteers that work on vaccines, we were watching California really closely, and it's really disheartening to see the kind of abuse that a legislator would, be placed under for trying to do the best thing. You're on a public health committee. You want the best interest for the public health. And, these groups are starting to kind of join with other kind of conspiracy theory, anti-government interference. Armed militias sometimes come to the hearings or to different meetings, and it's really becoming a much more aggressive and frightening atmosphere. And, Dr. Pan, it's amazing what you've done in California. We're so grateful. It makes me worry that other legislators will not have not the backbone. I don't want to say the backbone, but, fear for their own communities. First of all, fear for their physicians, and then fear for their lives if they're going to follow the same type of attempts to try to shore up public health and eliminate religious exemptions and, all non-medical exemptions.
Mm-hmm. And certainly, polling has shown consistently that vast majorities of people support vaccination. Doesn't matter your party, many demographics and so forth. There's very strong public support for vaccination for keeping kids safe, and but yet we have this small minority that is very vocal. I think the other thing I want to touch on is that talking about social media and being online, there are numerous reports of online bullying of families whose children have died of preventable infections. They'll post that my child died of flu and basically be driven off social media by anti-vaxxers, of physicians and nurses who are simply, giving scientifically based recommendations about vaccines. And then they'll have hundreds or even thousands of hateful, cruel comments and threats on social media in response to heartfelt stories of personal loss from families and science-based recommendations to protect families. How is the anti-vaccine movement essentially trying to silence families and health professionals advocating for good public health, for personal safety?
Well, I think it's sort of like a big mixing bowl right now. We're seeing it online. We were just talking about legislative efforts, and where I was recently in my home state, we're trying to eliminate the non-medical exemptions. And, after the Public Health Committee voted it out of committee, and thankfully, to move forward, everyone was yelling. All these anti-vaxxers were yelling, "We will remember in November." And they were aggressively, I won't say physically attacking, but really in the faces. And in my opinion, it was frightening, like running after the legislators as they were trying to get into the elevators who had voted to remove those non-medical exemptions. They fly individuals in, from out of state to testify. And, it's very hard to explain to a legislator that everyone in our state, we've done many polls. Vaccinate Your Family is, we really do a lot of polls to try to help bolster the information that's given to legislators and the public. And you're right. People appreciate vaccines. Like 90% or more are vaccinating on time. And to describe why we can't seem to get more people to come to the hearings, you have to kind of anecdotally say, my friends will ask me, Dr. Pan, I already vaccinated my kid. Why do I have to bother? Like, what do I care if there's low vaccination rates in my school? My kid's protected. No, they're not. Community immunity requires that there's a large pool vaccinated around you. Our vaccines are not 100% effective. So even though my kid's vaccinated for measles, mumps, rubella, chickenpox, they're not protected unless there's a large pool of folks around them. And so, those folks are just going about their daily business. They're not calling their legislators to say that they care about this law because they don't even know it affects them. Does that make sense?
Mm-hmm. Yeah.
And then with regard to the bullying online, it really makes me sad to see that happen. I can say that Vaccinate Your Family, we have many advocates. And one of our most vocal advocates, she lost her child to a preventable disease. And I called her. We very rarely call people. But I called her because I saw her article in the paper, and she was in USA Today, and I wanted to offer our condolences and asked her if she wanted to speak out. And she tells the story now when she speaks in public that she didn't call me back for weeks because she thought I was one of those crazy people who was going to yell at her for vaccinating her child, when in fact the baby hadn't even been vaccinated yet, and a NICU nurse gave the baby whooping cough, and the baby died. And, she didn't call me back because she was afraid of the ramifications. And you see it online now. People go out there and they spill out their heartbreak after losing their child to preventable disease, either because they weren't vaccinated yet because they're not done with their series, or they have immune compromising conditions, and then they get attacked. It's just absolutely horrifying.
Mm-hmm. Yeah, it is terribly horrifying, and it's. I think that the lack of respect some of these anti-vaccine extremists show to life and to other families is well, it's I'm not sure what word I should use. In terms of,
Dr. Pan, what's even more disheartening to me is when a child dies of a whatever unknown cause that's not related to vaccines, sudden infant death syndrome or whatever it is, and that family is grieving. Mm-hmm. And these activists now are using them and telling them that it was caused by a vaccine when all evidence points otherwise. And those people are being used as props for these activists. And I worry that when they come to realize 5 years down the road how wrong it all was, I shudder to think about what kind of depression they're going to go through because they really didn't have the opportunity to grieve properly when their child died.
Mm-hmm. Right. The false comfort that sometimes the anti-vaxxers pretend to give, but really are manipulating families for their own personal promotion, self-promotion. It's terrible. Now, as we mentioned, that they are online, but perhaps they're getting some help. Researchers have identified foreign domestic organizations who actually benefit from dividing Americans, are promoting anti-vaccine extremists online. They're boosting their posts and spreading their message. So when a parent is looking up things on social media, what should they be paying attention to? They see, they're just trying to find information about what to do for their kids.
Absolutely. And, really look at I would say go to the About Us section or do your research. You could even just Google that organization and try to see who is funding them. If they're selling products on their website, if they're selling natural products or something that will cure you of some ailment, you have to really consider who it is you're getting your information from. See that they're sourced. Make sure they're being sourced by credible research papers, journals, et cetera. Not an article that was written and self-published in someone's basement. Go to the CDC, the WHO website. There's so many sources out there now. And I think that the social media companies are doing their very best now. They're They have pop-ups that come up when someone searches on different topics, and they try to help explain where their credible sources are, but there's more that they could be doing.
Yeah, and I think, for example, the closed Facebook groups that the anti-vaxxers use to draw people in and then seal them into their echo chambers and also recruit the families you talked about who may have lost a child, they need to be perhaps opened up so that there is a way for people to get more accurate information and not just basically be isolated and so virtually in social media.
I've never thought of that concept. That's an interesting concept. I agree, though.
Yeah. Now, the state and local officials are working with physicians and scientists to prevent death from COVID-19. Anti-vaccine extremists are organizing protests against public health interventions to slow or halt the disease, even though there is no approved coronavirus vaccine. So what does this say about the anti-vaccine movement? There's no vaccine for COVID-19, yet they're protesting essentially any other effort to slow the spread of this COVID-19 pandemic.
Well, I think their true colors are really coming out right now. And, as we talked about before, there's been a increased level of coordination and collaboration among groups that are specifically anti-vaccine, anti-government, believe in some pretty crazy conspiracy theories, on a variety of issues, not just vaccines. I think coming all together years ago, they thought that they could, spread their disinformation wider and make people believe that vaccines weren't safe. The more they do now, the more I think people are coming to realize they don't truly care about anyone but themselves. And they're not staying home because they don't really care about the neighbor next door that may be elderly or the person who's high risk. It's clear that these are people who are very self-focused.
Yeah. Well, certainly, I think a vast majority of Americans support vaccination. A vast majority of Americans care about each other. But unfortunately, there's this minority who doesn't. And unfortunately, they are trying to infect others with disinformation, lies, conspiracy theories, and unfortunately, in the end, disease.
I would agree. I mean, more than 90% of us are vaccinating on time. And I think those who aren't maybe have access issues. They can't afford a vaccine. They're working double shifts. They can't get their kids in on time. I think most people really do trust, in our government. The oversight of vaccine safety is the greatest in the world. I vaccinate my family. I get my vaccines on time personally. There's an awful lot of factual information out there. I think these anti-vaxxers are spreading a lot of seeds among new parents, but it's my hope that, COVID may turn the tide, right? Everyone wants to know how to flatten a curve. When is the last time you ever heard somebody ask how a virus works, right? How immunity works? I think we have a really good opportunity in front of us if we can just take advantage of it.
Well, thank you so very much, Amy, for joining me today and for sharing your experience and knowledge about vaccine and vaccine policy. So I want to thank you for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for a future podcast, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wash your hands frequently and try not to touch your face. And if you have children, be sure they're vaccinated on time. Together, we're slowing the spread of the disease and saving lives. Thank you so much for listening.